Hi guys, welcome back to my channel, and I hope you guys are doing well and are staying healthy and safe. So today's video is going to be a little bit different, as you can probably tell. I was born with a chromosomal abnormality called Turner syndrome, and I just wanted to go over what exactly that means and how it affects my everyday life, and just raise awareness for this rare condition. So, what is Turner syndrome? It is a chromosomal abnormality that only affects females, and it occurs in about 2,000 to 2,500 live female births, and only about 1 to 2% survive to birth. The other 98 to 99% are either miscarried or stillborn. And so, as I'm sure a lot of you are aware, typically the males will have an X chromosome and then a Y chromosome, and then females will have two X's. In Turner syndrome, the second X sex chromosome is either missing partially or completely. And so, how is this condition diagnosed? So, it can be diagnosed through what's called an amniocentesis, where the amniotic fluid, which is the fluid that surrounds the fetus in the uterus, is collected to check for any genetic abnormalities, not just Turner syndrome, but like Down syndrome and things like that. And then a blood test. A sample of blood is taken to create what's called a karyotype, which is basically a analysis of the chromosomes. And some women are not diagnosed until later in life. So I'll talk a little bit more about that in just a second. So here are some physical signs of TS. Short stature, a webbed neck, which basically is just extra folds of skin on the neck. Low set ears and a low hairline. A broad chest, having a lot of moles, and a high palate, which is like kind of like a high roof of your mouth is the best that I can explain it. And because going back to how some women are not diagnosed until later in life, well, sometimes, excuse me, I have some really bad allergies. Sometimes because some women don't present with symptoms right away. They're short, they don't go through puberty, so doctors usually just assume that they're a late bloomer and don't assume anything is wrong until usually somebody decides to look further into it. Now, there are some medical issues that TS women have, such as congenital heart defects. Congenital meaning the person was born with it. And some examples include coarctation of the aorta, which basically means a narrowing of one of the main, I think it's a blood vessel. Well, it's how the blood gets from the heart to other parts of the body. And bicuspid aortic valve. So typically, people will have 3 aortic valves, but sometimes women with TS will only have 2. and partial anomalous pulmonary venous return, which basically means that some of the veins in the lungs, the pulmonary veins, are not correct, are not in the right place. And another thing is hearing loss and chronic ear infections, osteoporosis, which is a weakening of the bones, scoliosis, which is a curvature of the spine, celiac disease, which is sensitivity to gluten, hypothyroidism, which is a underactive thyroid, not to be confused with hyperthyroidism, which is an overactive thyroid. Think hyper, you have a lot of energy. Kidney issues, diabetes, and because of the short stature, we are at an increased risk of obesity, and like I mentioned before, infertility. And there are some mental manifestations that Turner girls have to deal with. We kind of do tend to get fixated on things and ideas, things of that nature. Some of us do have poor social skills, like not being able to read a person's facial expression and understand when somebody is being sarcastic. That can be very difficult for Turner girls. I personally do struggle with that sometimes. Sometimes it's hard for me to understand when somebody is being sarcastic and when they're being serious. I'm typically pretty good, but there are some times where I feel like they're being serious when in reality they're being sarcastic. And depression and anxiety and other mental health issues. I think just for the fact that, you know, you can feel different than other people, you're shorter than other people, you have, you know, some medical issues, and that can take a lot out of somebody. And you also have some learning difficulties, especially in math. I am not good at math at all. I do not like math whatsoever. It has always been one of my worst subjects. So that can also kind of lead to depression and anxiety. And we have what's called a visual spatial deficit, which is the ability to determine the distance between objects. And so this can affect us in geometry, in math, and driving. It may take a little bit longer for a TS girl to learn how to drive, just because it can be a little bit difficult to determine how much distance you need between cars. And some treatment options. Now, I want to really stress that each and every girl with Turner syndrome is going to be different. Just because these are all of the medical issues that a Turner girl may have, that does not in any way, shape, or form mean that she is going to have all of these. There are some women who do not have medical issues, and there are others that do. And that's also kind of part of why some women are not diagnosed until later in life, is because they're not presenting with these typical medical issues. So again, I really want to stress that each and every TS girl is going to be different, and so treatment really kind of just depends on exactly what medical issues she has. So again, every female with TS is different. So it is important to note that treatment should be specific to her needs. But just some of the common treatments include growth hormone injections. I personally was on growth hormone injections from the time I was about 18 months until about 13, 14 years old. twice a day, every day, morning and night. So estrogen replacement therapy, again, because we are missing that second sex chromosome, that can lead to problems with, breast development and periods, things like that. So that kind of helps in that regards. And then some women, despite being infertile, are still able to get pregnant through IVF. But again, I want to stress each and every TS woman is going to be different. So obviously, for a TS woman who plans on becoming pregnant, she would need to talk things over with her doctors and make sure that the pregnancy will be a healthy one and not put her or that baby at risk. And some resources are the National Turner Syndrome Camp, which I did attend for 3 years, and it was an awesome experience. I met a lot of amazing TS sisters, and yeah, just a really awesome experience. We did a lot of fun things like going to theme parks, having a pizza party, swimming, seeing plays. It was an awesome experience. And then the Turner Syndrome Foundation and the Turner Syndrome Society of the US. So, with all that being said, girls with Turner syndrome can lead very normal lives if they have a great support system and a great team of medical professionals behind them. Then there is no reason why a Turner girl cannot do anything that a normal women can do. Us Turner girls do have some challenges, but we're fighters. We are fighters, and we, will overcome them. Yes, I have Turner syndrome, but that doesn't define who I am. I'm much more than just Turner syndrome. I can sit here and be like, oh, I have Turner syndrome, so I have all of these, difficulties. I can't do anything, blah, blah, blah. Or I can be like, yeah, you know what? I have Turner syndrome, and with that comes some difficulties. And I can pick myself up and be like, you know what? We're going to get through these difficulties one way or another. And I give my parents a lot of credit for not letting me use the fact that I have Turner syndrome as an excuse not to do anything. Because Turner girls are very capable. Don't underestimate us. We are fighters, and we're resilient, and we have a bond. It is a sisterhood. Alright, so that's about it for this video, and if you need to talk to anybody, please feel free to contact me. I always have my social media links in the description, so you can message me on there, and I also will have my email link below, so if you're more comfortable emailing, you can email. And I will also post some links to these resources. Alright guys, take care, love you, bye.